Good evening, everyone. Thank you very much for joining us on tonight's coronavirus telephone town hall. As we just wait for a few more constituents to get on the line, I wanted to take a moment to briefly introduce our speakers. Congressman Eric Swalwell has been representing California's 15th Congressional District since 2012. He serves on both the House Intelligence Committee and House Judiciary Committee. He is also the co-chair of the Democratic Steering and Policy Committee. Also on the line is Dr. Arthur Reingold, the Division Head of Epidemiology and Biostatistics at the University of California, Berkeley School of Public Health. Professor Reingold has worked for over 40 years on the prevention and control of infectious diseases, both at the national level, including 8 years at the U.S. Centers for Disease Control and Prevention, as well as with numerous developing countries around the world. And Dr. Michael Anderson is also joining us. He's the president of the University of California, San Francisco's Benioff Children's Hospitals and senior vice president of Children's Services for UCSF. Dr. Anderson is a nationally renowned authority on children's health policy, pediatric disaster preparedness, system quality, and physician workforce. If at any time throughout today's call you'd like to ask a question, please go ahead and do so by pressing *3. And if you would like to be added to our email list or leave your contact information with our staff for follow-up, please press *6. With that in mind, we will go ahead and begin today's call. So Congressman Swalwell will now begin tonight with some opening remarks. Congressman?
Good evening, and thank you to everyone for joining tonight's call. This is a defining moment for who we are as Americans. It is a time that has disrupted our daily lives in the Bay Area, and it's a time where we need leadership, but more than that, we need all hands on this crisis. On this call tonight, we have two experts who know about the coronavirus and what we can do, and I have asked them to join us to assist me in explaining what the challenge is ahead, what we can do as far as the healthcare side of this crisis, and also what we can expect as we look at testing, treatment, and a vaccine. And so I will introduce them shortly. Today, it's March 19. It's a Thursday. Any other year, March Madness would be beginning tonight. Any other year in the Bay Area, high school seniors would be getting ready to walk for graduation. College seniors would be getting ready to start their first jobs. Any other day in the Bay Area, construction sites would be humming along as our economy locally continues to grow. And we were seeing record unemployment, where the biggest problems that we faced were a housing crisis because of the cost of housing and congestion because of the amount of time all of us spend in traffic. If you look at the freeways today, they're empty. Home prices are falling. We are a country in crisis, but we are a country that has taken on crisis before, and I'm confident, knowing who we are here in the East Bay, having met so many of you, having worked with so many of you, that this is a crisis that we can overcome. We've got this if we do it right, if we listen to the experts, and if we have leadership from the White House and in Congress, we can take this on. I want to tell you where we are. I've spent this week and last talking to our local healthcare professionals. And I start with healthcare because I see this as a two-crisis challenge. We have a crisis in health and a crisis in our financial wherewithal, personally, but also in the business communities across America. I'm going to start with health. Talking to our local hospitals, I have learned that they are doing all they can, working overtime and around the clock to stand up their facilities to make sure that they can meet what they see as a wave of need that is coming their way. We have had positive cases already for COVID-19 in the East Bay, but there will be more. And what the hospitals need now more than anything are tests. They need the tests that will assist them in determining just exactly what our exposure is with this virus. The more we know, the better we can contain it, the better we can isolate those who have it, and the better we can treat those who are going to be at risk of succumbing to it. That has to be the first priority, is testing, testing, testing. I'm working with our local hospitals to make sure that we get them tests as soon as they can. There's a shortage of tests right now. The good news on that, we have two facilities in the East Bay in our Congressional District at Roche and Thermo Fisher that are mass producing the tests. We're way behind in where we should be, but each of them has assured me that thousands, if not hundreds of thousands of tests will be mass produced from these facilities in the coming days that will be distributed not only in the Bay Area, but across the country. Not only can they mass produce tests, any facility, laboratory that has their instruments, they can conduct the tests, the diagnostic, at 300 up to 900 different tests within a 24-hour period, wherever these instruments are. And so making these instruments is also going to be critically important. And I'm doing all I can to support those facilities to make sure that they can get those to our healthcare providers. Now, to the folks who are working at these hospitals, they're on the front lines and they are owed our gratitude. And so we have to do all we can to support them, to make sure they have the personal protective equipment that they need to not expose themselves and keep working around the clock. Finally, it's a race for a vaccine. It's a race between this virus dying, not spreading any further, and a vaccine being found. I hope this virus dies first, because all of the experts will tell us that a vaccine, yes, is in reach, but it's a 12 to 18-month reach. And we can't have more people succumbing to this virus, and we can't have an economy on its knees because of this virus. So what we do personally is what's going to get us out of this. Finally, on the financial track, and we're going to talk a lot about this tonight, I see a two-track issue here. First and foremost, we have to do in Congress everything we can to stimulate the economy in a way that businesses keep their employees employed. Not only getting the wages, but also the benefits, particularly when you have a healthcare crisis. And those decisions are being made right now. I've been on phone calls with Speaker Pelosi every day as a member of the leadership team to make sure that happens. For anyone who has lost their job, I'm sorry that's happened. I know how frustrating that is. I have personal family members who have lost their job in the last couple of days. We must increase and supplement the state's unemployment insurance immediately to make sure that anyone who's lost their job can pay their immediate bills. Finally, you may be asking, what can you do? And I promise you, you're not helpless. None of us are helpless. What we do now in the next coming days will determine not only the future of our country, but the future of the global economy. We have to isolate ourselves physically, not socially, but physically. We can stay in touch by FaceTime and text message, wave to each other from the front lawn across the street, talk to our neighbors across cul-de-sacs, but we have to isolate ourselves physically. We no longer can engage, congregate in the ways that we did before until this virus completely dies. If we do that, we are able to defeat this virus. But as you see, we are only able to do this, and we work at the will and mercy of the lowest common denominator. If the Bay Area is in social and physical isolation, but South Florida and other places are not, we cannot get back to business as usual. We will not be protected until we see the peaking of this virus and then getting down to zero cases in every region. Otherwise, if we go outdoors again, if our hotels open again, if our restaurants are open again, we're at risk of someone from a community that has not seen the peak yet coming into our community. So it's important that we are all in this together, because we can all get out of this together. Finally, I just want to tell you that in isolation, in physical isolation, we have all come to see in the last couple of days that we need each other. We miss each other. We want to go back to being together. And the sooner that we take these steps to address the healthcare needs, the financial needs that affect our rents, our mortgages, supporting our families, and taking the isolation steps that we have to take, we can get back there. I know we can do it. We will play our role here in the Bay Area to do it. And with that, I want to turn it over to Dr. Reingold, who is the division head of Epidemiology and Biostatistics at the University of California, Berkeley, and Dr. Michael Anderson, who's the president of UCSF Benioff Children's Hospital and senior vice president of Children's Services for UCSF. Thank you both for joining us.
Great. Well, thank you, Congressman Swalwell. I'm honored to be asked to help with this. I was asked to keep my remarks to just a couple of minutes, so we have plenty of time for questions, and I'm happy to do that. And I want to start by saying that one good thing about the age we live in is that every one of you, if you have access to the internet, can update yourself on an hourly or daily basis through the websites of the World Health Organization, the Centers for Disease Control and Prevention, and the New York Times, as well as other news outlets, because they're doing a very good job of tracking things and making the data available. So you don't need to rely on people like me to get you the numbers or the current status of affairs. So just very quickly, I think many of you know that this coronavirus, this COVID-19, originated, we think, in a bat, made it into humans, and then, like at least a couple of other coronaviruses, unfortunately could be transmitted from person to person. Well, this did happen in China. This is not a virus. This is not a Chinese virus. This is a virus that can infect anyone. And unfortunately, it's now causing a pandemic with substantial numbers of cases and unfortunately lots of hospitalizations and deaths in a number of countries. So while the virus may have begun, the disease may have begun in China, and they had something like over 80,000 cases, they reported today that in fact this was the first day that they did not have a new endemic case acquired in China, which is truly a remarkable statement and testimony to what can be done through these control measures that the congressman mentioned, even before we have a vaccine. Unfortunately, we've seen very troubling increases in the numbers of cases in Italy, with over 40,000 cases and several thousand deaths, in Iran, in Spain, and in many European countries. Here in the United States, at least according to the figures I saw this afternoon, we have a little under 12,000 cases and 179 deaths. And certainly here in California, we are affected by this virus. I'm sure many of you know that we've had transmission of the virus in a number of counties in the Bay Area. We have involvement of some nursing homes, and that's particularly a problem because this virus is most deadly in the frail elderly, and often that's the kind of person who is in a nursing home. So while there certainly is research going on quickly about vaccines, and people are experimenting with a variety of drugs to try and treat this virus, at the moment we really don't have an established therapy. And as the congressman said, we really will not have a vaccine for at least 12 to 18 months. So you'll have seen that the governor today made a request to the federal government for a military ship to provide backup care, and talked about some fairly dire projections for the state of California. We certainly hope we can avoid reaching the numbers of infections that he was predicting, but that's going to take, as the congressman said, an enormous effort on all of our parts to reduce our exposure to others, to not expose others to us. The standard things like hand washing and covering your cough and sneeze, not going out if you're sick, sheltering in place. These things can make a difference. They certainly have made a difference in Korea, South Korea, in Singapore, in China. And so we know that we can reduce the scope of this outbreak even before vaccines and treatments are available. So I'm going to stop now because I'm sure there'll be lots of questions, and I'll turn things over to my colleague.
Thank you, Dr. Reingold.
Dr.
Mike Anderson here. Thank you so much. Mike Anderson, I'm a pediatric intensive care physician, a hospital president, and have been involved with the disaster response in Washington, pardon me, at the CDC for about 15 years now. Congressman, it really is an honor to be with you and to speak about the interesting, challenging time in our country. I want to echo two things the Congressman said. It is a concerning time. As Dr. Reingold pointed out, this is a new virus. None of us have seen this virus before, so none of us have immunity to it. It is contagious. We've seen the spread, and unfortunately it has a higher mortality rate than the normal flu. But the reason that I agree wholeheartedly with what the Congressman said, he said, we've got this. This is not a time for panic. It's a time for planning and for response. And what is different in modern medicine compared to the 1918 flu or compared to other outbreaks over the past 200 years is, as Dr. Reingold said, rapid communication. We can put together communication in a heartbeat. Number two, this is the age of modern medicine. So going from a virus to a vaccine in 12 to 18 months seems like a long time, but that is light years ahead of what we used to have to endure in medicine. And then finally, there have been fits and starts. There's still big challenges ahead, but seeing the private and public sector come together in this response, seeing pharmaceutical companies and manufacturers say, you know, this is a wartime effort and we are going to stand up and be a stronger country. I got to tell you, the healthcare system has been working 24 hours, 7 days a week for the last 6 weeks, but we know that we've got this. I do want to talk a little bit about the hospitals and how we're preparing in the Bay Area for this. I'm a part of the UCSF command structure or leadership structure. We've been meeting for about 7 weeks since this first started to ramp up. Our number one goal is to protect our patients and our families and our caregivers. Number two, to be there for the community. God forbid the cases start to ramp up and more people need care. We've got to be there and be prepared. And we really think about this in three categories: staff and stuff and space. We've got to protect our workforce so the doctors and nurses and respiratory therapists will be there. Stuff, we've got to have enough personal protective equipment, enough swabs, enough ventilators. We've got to secure enough stuff. And then space. As the congressman said, and I think Dr. Reingold said as well, this calls for what's called alternative care sites. We've got to figure out different places that we can care for patients. So it has caused us to do some things we never thought we would have to do: canceling elective procedures, limiting the amount of visitors that come to our hospitals, screening our employees. I was asked questions this morning as I came to the hospital: do you have a fever? Do you have any symptoms? We've got to protect our hospitals and our staff. And then finally, you've seen a new hashtag, a new term, flatten the curve. And I'd agree with the congressman that this is so difficult to tell people you've got to stay home, you can't congregate, you can't go to your favorite restaurant. But as you've seen from the epidemiology, if we can contain and keep away from each other, quite frankly, we're going to be able to change the curve of this outbreak and hopefully not overwhelm the healthcare system. So once again, it's an honor to be on this call. I am so proud of what the hospitals are doing in conjunction with the private and the public sector. And as the congressman said, if we work together as a community, we will get through this stronger.
Thank you again. And we are now going to, again, thank you, Dr. Reingold and Dr. Anderson. That's very helpful. And I'm going to ask you to participate and take some of these questions. So we're going to turn this over to Natalie on my team, who is going to help us facilitate these questions.
Yes, thank you all. We will now open the line for questions. Remember, if you want to ask a question, all you need to do is dial *3, and your question will come into our queue. Our first question is from John from Hayward. John, go ahead and ask your question.
Hey, I'm sure we've all seen social media posts about nurses complaining about the lack of personal protective equipment and about California's inability to protect them as they're required to under law. I think this has to be prioritized above anything else, because without the people, the stuff will do us no good at all. What can you do to help about that?
John, thank you so much. And this is the concern I've heard from our hospitals in the last couple of days, which is you have to protect the people on the front lines, because if a nurse gets sick, then you have others that nurse was exposed to, and you could see a whole, battalion of nurses at a hospital go down. And not only we want that nurse to be healthy for their own sake, we could see a community affected by that. So yes, getting the recent legislation we passed, signed into law by the president, I believe yesterday, increases what we will spend on personal protective gear, trying to get that out as soon as possible. What we all can do in the community, and I just posted this on Twitter today, is if you know of anyone who has N95 masks in bulk supply, please work with our office. We are facilitating the receipt of those and distributing those to the local hospitals. Now, who would have those? Builders. in the Bay Area, you see the cranes, you see the housing projects, the large construction sites for businesses. They use N95 masks at their sites, and I have worked with the local building trades and contractors to get some of those masks to our office that are not being used because their sites have been shut down. If you know of anyone who has these, please work with us. We got a call today from someone in Iowa who said, I panicked, I got nervous, I bought 30 boxes of these N95 masks. I obviously don't need them. I want to give them to someone who needs them. We're going to take those masks and give them to a local hospital. But that would help a lot right now. And if you go to our Facebook or Twitter page, you will see how you can assist us in getting those masks. And if the medical experts have any thoughts on that, I think that would be helpful.
Yeah, it's Mike Anderson. I'll just add briefly, I could not agree more that this is a top priority. We meet as a command staff at least twice a day, and this is always one of our top concerns. I would agree with the congressman. We've got to figure out what unique sources we can tap into, and construction folks have been coming forward. Our private sector, the Home Depots of the world have really been helpful. We also have to make sure as a community that we're using PPE appropriately in the community. So even in my hospital, the guidelines from CDC as to how you use PPE sometimes are changing in real time. I understand that. But if you don't need to wear an N95 mask, especially in my hospital, we're asking our caregivers, please, let's make sure we follow the rules so that in 2 weeks or 10 days or 3 weeks, we're not short.
Great. Natalie, why don't we take the next question?
Great. Our next question comes from Jill in Pleasanton. Jill, you can go ahead and ask your question.
Hi, I have two questions. The first question is actually about the N95 masks. I have 5 individual masks. I don't have bulk. So would it be better for me to drop them off at the local hospital, or I have a friend who's a nurse to give it to? And my second question is, I just signed up to volunteer to deliver meals to housebound seniors via Open Heart Kitchen. And other than I can wear a mask, I have gloves, I can hand sanitize in between deliveries, stops. Is there anything else I can do, and obviously the 6 feet distance, to protect both the people I'm serving and my family at home?
Great. Maybe Dr. Reingold, you could talk about just what she can do, and maybe Dr. Anderson, your thoughts on who she should give the masks. So I would say
sure.
If you want to bring them to our Castro Valley office, that's where we're receiving them, but go ahead.
Well, it sounds like you're already quite well informed on what you can do to both protect the people you're delivering the food to and to protect yourself. So I don't have a lot to add to that. Obviously, on some of the cruise ships and other places, people have basically left the food on the doorstep and rung the bell and, been even further away than the 6 feet. So it isn't necessary that you interact with the people. That certainly would provide some additional protection, but everything else you said is spot on. So I don't have a lot to add to that, frankly.
Yeah, it's Mike Anderson. The only thing I would say is number one, thank you, because I do believe this is a time I worry about the most vulnerable amongst us. Although I'm a pediatrician, the most vulnerable amongst us include the elderly, who already baseline have significant, episodes of loneliness or significant occurrence of loneliness. So anything we can do as a community to check on our neighbors while following the rules you really eloquently outlined. I don't think I could add anything except to say the obvious, that if you feel even a touch ill, to not participate in that. As far as the masks, I think coordinating through the congressman's office is probably the best way. We're this, once again, public-private partnership, I think we're really starting to rely on more and more.
Thank you. And we have a phone number you can call if you want to bring them by, because we're not at the office, we're telecommuting, but we will have designated times where we can receive those. Natalie, next question.
Great. Our next question comes from Jimmy in San Ramon.
Hello, Congressman Swalwell. Thank you for everything you do, and thank you for this call as well. Couple of questions. One of them is, we want to support the restaurants, locally here too. We can't go into the restaurant, but to do takeout. But one question is, so is it safe? Is the food safe? Is the packaging safe to do takeout to do that way? And then the second question is, understanding that if you have symptoms, and that's how you would, you could pass it. If you're asymptomatic, if you don't have symptoms, you're not coughing, if you're not sneezing, and you're not touching people, then can you still pass it on to people? Those are the two questions.
Great
Thank
question. You. Yeah, no, great question. I had takeout tonight. One, I want to support restaurants that are doing this, and also two, I think by doing that, if you can, you free up groceries during this rush. And I just want to say, we have an adequate food supply in our country. I spoke with the chairman of the Agriculture Committee in Congress today, who assured me that he's spoken with our food distributors. There's no shortage in food supply. But if everyone goes at the same time, there will be, temporary shortages. But as to some of your questions about, whether it's safe for takeout and also the symptoms, I think Dr. Reingold might be best.
Sure. So those are great questions. While I think one say never say never, I personally think that, first of all, there's no evidence whatsoever that the virus could be transmitted on food. And so if your concern is, could it be transmitted in the food itself? I think the answer is not as far as we know, and I personally would be comfortable getting takeout from a restaurant. Could it be transmitted on the packaging itself? Well, the most recent study looking at the virus and its survival on materials suggests perhaps it can survive on metallic surfaces for a few hours, perhaps up to a little longer than that. But the survival on cloth and cardboard and things like that is much, much shorter if it gets there at all. So I think the risk associated with the packaging is, as far as we can tell, very, very low. Now the other question you asked about how can you transmit if you're not having symptoms, I think is a really great question, because we think in general most of the transmission is done by coughing and sneezing. But there is some evidence of asymptomatic individuals being able to transmit, and if that's the case, then presumably it has to do with them touching their nose or their mouth or their eye, getting the virus onto their hand, and then transmitting it from their hand. Presumably kissing and other things like that could transmit it. But we think that that's, not nearly as infectious as people who are coughing and sneezing. And I don't know if Dr. Anderson wants to add anything to that. But
no, I think you covered it very well.
Great. Natalie?
Great. Our next question comes from Armando in San Lorenzo.
Hi, just a couple of questions. First and foremost, the symptoms, we hear different things, but in a nutshell, if you could just run through the symptoms first, and then second, I know there's that test out there, but if you have these symptoms, what do you do real quick if you could run by that? And then the third, somebody that gets it, is it a length period that they go through and it gets out of their system? I know we don't know too much, but is there a time period of when it's out of your system, or maybe you're okay, you just kind of your body works through it? Can you just run by that real quick?
Sounds like Dr. Anderson.
I'll take a stab.
Yep. Go ahead, Dr. Anderson.
I'll take a stab. Really great questions. I feel like I'm in the presence of a really smart medical student asking me and pushing me hard. So that was a really great question. First, the symptoms. We think there's a constellation of symptoms in patients that are active with the COVID infection. Cough seems to be almost universal. This virus seems to attach to the lining of the lung. So irritation and cough seem to be one of the major symptoms. The other sort of non-specific symptom is fever. We're really on the lookout for patients with fever. And then there's the other quote-unquote sort of viral stuff, and that is runny nose, that is aches. But certainly cough and fever appear to be the major symptoms. The second thing, what to do. So I think probably every American in the country is now thinking, okay, God forbid tomorrow morning I start to feel a little achy, I get a fever, and I get a cough. Unless you have major symptoms, like you can hardly breathe or something's very dramatic, we are asking people not to instantaneously come to the emergency room, but reach out to your primary care provider and share the symptoms. Now, once again, of course, it's your discretion. If you feel like you got to call 911 and get to the ER, then that's up to the individual patient and their family. The reason that we're relying more and more on telemedicine visits and not having people come to the ER or come to the primary care office is if your symptoms are mild and there's probably nothing that we're really going to do acutely in that first day or two, then we can keep you from coming to the emergency department or infecting others. So you asked a really good question of what to do if you get symptoms. So my bottom line is reach out to your primary care doctor. The primary care doctors are obviously very busy fielding a lot of questions, and then work with them on whether you should physically seek care or not. So we're asking you not to automatically physically come to a care facility. The final thing about timing is I think that is a really good question. How long do you remain infectious? What we typically think in viral infections are you remain infectious until your symptoms and your fever have dissipated. The exact timing of which in the COVID virus I think is really unclear, but I've been saying for years as a physician, when your symptoms abate, then that's when you're less infectious. And I'm not sure if we want to add anything else to that.
Could I add just one quick additional point?
Please.
Which is, I think what Dr. Anderson said is spot on, but I just want to point out that if you're going to go to your healthcare provider, it's really good to talk to them first so that they know when you arrive that you should have a mask on, or to put you in a separate waiting area just to reduce the chances that you potentially are infectious and might infect somebody else in the waiting room or one of the staff who isn't aware of the signs and symptoms you have. So that's the other reason we'd like you to alert your healthcare provider first.
Good point.
Great. Our next question is from Joshua in Dublin.
Hello. I am a college instructor, and I have a student who's been talking to me about being ill, and I've been recommending that they get tested as it's the symptoms, but they just haven't directly been in touch with somebody who has been diagnosed with COVID. And they're very concerned about access to it being affordable. They've contacted the emergency room and only been told that they can apply for aid, but it's just not certain to them, and they're just not in a financial situation being a young person to, should I get tested? Should I not get tested? Are they going to spend lots and lots of money to just get nope, you're not tested? So what
Joshua,
should they do?
That's a great question. So the legislation that we passed, just signed into law yesterday, it is free testing. So they should not worry about the cost. I think, as Dr. Anderson and Dr. Reingold have pointed out, they should only worry about, are they going to burden an overburdened healthcare system if they don't have the symptoms that were described, which is, respiratory issues or organ failure. If it's a fever and a cough, but nothing that, threatens your ability to breathe or, otherwise function, that would be a burden if everyone with those symptoms came, to the emergency room. Now, all of that being said, the local hospitals have tests. They've assured me that they have tests. The challenge is going to be as more and more people present, making sure that they have enough tests. But I'll turn it back to Dr. Anderson. But as I understand what you were saying, Dr. Anderson, it's that if fever, cough, don't go to the emergency room. Only go for a test and treatment if it's respiratory failure.
Yeah, or chest pain or, God forbid, major symptoms. That's a great point, Congressman. I think for the individual student that you're talking about, I do believe a conversation with the primary care doctor, another conversation, because as the Congressman said, thanks to his hard work and the hospitals in the East Bay, we're going to work with the counties to stand up more and more sites for testing. So the exact person that I believe these testing sites are ideal for is the student that you speak of, where thanks to the Congressman's hard work, the test will be free. Thanks to health systems working with the county, we'll have more and more sites that will not be at the hospital, once again, to try and prevent the spread in the institution, in the hospitals, but at some remote site. And once again, I was on a call just before the town hall where those are more and more taking shape in very rapid fashion. So I think bottom line, continue to talk with the primary care doc. I tend to think just in what you reviewed with us, that young person getting tested in the future is a good idea. But I think if you look to early next week, once again, thanks to a lot of hard work, there'll be more and more of these centers that the primary care docs can refer to so that patients who don't need emergency room care aren't there.
Great. Our next question comes from Peggy Lee in Union City.
Hi. Thank you so much for going ahead and having this. My question is on the health side is how are we helping prevent spread from homelessness, people that are currently homeless, and people that are currently also being released from the jails early in order to go ahead and free up space there as well. I know.
Peggy, yeah, keep going. Actually, I think Peggy may have, the moderator, when I talk, I think accidentally cut you off. Sorry about that. And you can follow up with me by direct message if you'd like, Peggy. But on the homeless and our inmate population, homeless, it's a challenge. And I know the county is working to find places for what the hospitals call, I believe, persons under investigation. So if a homeless person has the symptoms and you're concerned about whether they could isolate, making sure that there are resources in Alameda County for them to go to, and looking to work with local providers who could house the homeless. But I know from working with the homeless as a prosecutor and running our homeless court that it's not just that many of them are homeless. Many of them have mental health challenges that have not received the treatment they need, and so you're trying to work with somebody who has other conditions and to get them to isolate is difficult. Second, on the inmate population, I have two brothers who are deputy sheriffs and have worked at the jails, and I believe right now any new person that comes in is being tested because they cannot put into the pods that they have at Santa Rita with dozens of inmates somebody who could infect the whole jail. So ironically, if you get arrested, you have a better chance of getting a test today than somebody who is like that student earlier, and that's why we need to kind of change the dynamic here and mass distribute the tests. But I too am worried about our inmate population and want to make sure that the jails are containing that and have been in talks with the county about what we can do to support that. And I don't know if any of the doctors want to weigh in on that.
Well, I would just say that certainly Alameda County, but also San Francisco County, on their advisory committee, I know is working really hard on the homeless issue to try and because clearly many people in homeless situations cannot wash their hands, even if we tell them they should wash their hands, and a host of other issues. So I know that a number of the counties are working really hard on this, but to be perfectly honest, I can't tell you exactly what they've accomplished so far.
Great. Our next question comes from Phyllis in San Ramon.
Hi, Congressman Swalwell. I'm a healthcare worker. Came down with symptoms on Tuesday night. Talked to my physician by telephone yesterday morning. He recommended testing. I had to drive from San Ramon all the way up to Walnut Creek to get tested while I was sick by myself. And now they told me I have to wait 3 to 4 days for results. And so I just wanted to know, my husband has not been tested. He most likely has it if I have it. And if they tell me in 3 to 4 days and then they test him, he has to wait an additional 3 to 4 days. And in the meantime, if he goes out, even with a mask, there's a risk that he's going to infect other people. I just want to know, is this situation with the amount of time that people have to wait to get tested, especially healthcare workers, going to improve? And why aren't they testing people who are already being tested that live in the same household? And I just want this situation to get better, especially for healthcare workers. We should be tested by our own hospitals.
Thank you first and foremost, Phyllis, for being a healthcare worker on the front line when we need you more than ever. The goal is, yes, as I talk to our leadership in the Congress, is that people can get results within 24 hours, that we have the resources, not just on the testing kit, but also, the instruments that do the testing, and to mass test is the best way to do that. Now, there are some issues in the supply chain for these instruments. A lot of them come from Europe, from Asia, and those supply chains have been disrupted because workforce issues over there as well. But we are doing all we can to increase on both the testing kit side and the instrument side so that results can be known much sooner. But I think I'll give it to Dr. Anderson first, just as a healthcare worker, some of her questions.
Yeah, I could not agree more with several things you said. Number one, we've got to be able to expand the testing so that if primary contacts like your husband, if it makes sense to your physicians to get them tested just so we know what we're dealing with, that is, of course, got to be the goal. As the congressman points out, there is a real limit currently to just the basics of swabs and kits and reagents. So I know that there's people in the private sector working really hard, trying to come up with just innovative ways to come up with more of a supply chain. The second thing I will say to your point about healthcare workers need to have their own institutions be able to test them. We've got, thousands of people that work for UCSF, and thanks to our amazing unsung heroes of occupational health, employee health, we are testing those caregivers that have either come in contact with a patient or think they have it, because we've got to know what's going on in our own hospitals. But having said that, we are also starting to run short on the supply. So everything the congressman and his colleagues are doing to start to increase the supply of this. I'm normally an optimist in life. I'm optimistic in the next 5 to 10 days. We will start to see more of these testing centers and more stuff, but it's really going to take people working night and day to increase the supply chain issue.
Phyllis, I also want to say that part of the legislation we passed is 14 paid sick leave days, which means that if you have to take sick leave because of COVID-19, that you have to be paid for that. Not every employer provides that, but our legislation says that for any employer, 500 persons or fewer, they do have to provide that. That April 2nd is when the Department of Labor has to give guidance on where to be reimbursed for that, but that is coming. That's going to be imminent. So please, track those days and make sure that you're paid either by your employer or through the federal government.
Great. Our next question comes from Rena in San Ramon.
Hi. Thank you for having this, Congressman Swalwell. My question comes from being a community college instructor, and my students and the instructors also have the same question as far as how long is, are there any predictions for the stay in place that we're in right now, in any kind of way? And connected to that is, it seems like when I watch the news and I see different mayors of different states speak, it just seems like some of them are a little bit more serious about and have a sense of urgency more than other states. And so how will that affect how long we will be in this kind of situation where we are in a stay in place?
So this is Art Reingold.
Yeah, go ahead, Art, please, to take the question.
Yeah, sorry, didn't mean to interrupt. So I think you raise a really important point. And so I would say, in all candor, we don't know exactly how long the situation is going to last, but clearly, to the extent that people take it seriously and do stay home and avoid contact with others, the better people do at that, the shorter the period should be. And if people are really not taking it seriously and are out and about, then it's likely, we're going to continue to have transmission and the problem will persist longer. So I think the fact that different states seem to be coming on board later than others, I just saw in the news tonight that several states that had not been doing very much have just started doing quite a bit in terms of social distancing maneuvers. So, but I would agree with you that we as a country and as well as a state need to all work on this together. And if we don't, then these measures can't be as effective as they should be.
And I just want to add to that because I'm looking at CNN right now and I see that Governor Newsom has asked all 40 million of us in California to shelter in place. We have to lead by example. And as Dr. Reingold said, the sooner we are able to physically isolate ourselves, the sooner this virus dies. If a virus cannot infect other persons, it just dies. It's the best example I've seen is kind of a row of matches and the flame going down each match, and one match is pulled back and it can't spread any farther. That's where we have to get. Now, it's frustrating to see other states not caught up with the Bay Area, but that's how life works in the United States. The Bay Area is always leading the way and everyone else catches up. And I think leading by example, by doing the physical distancing, seeing our cases peak and then start to drop, will get everyone else on board. But that's just what we're going to have to do to make it happen. And I guess, to your question, what does it mean? So it doesn't mean you can't go to the grocery. You can go to the grocery store. You can go to the pharmacy. I was at the pharmacy yesterday for my son's asthma medicine. You can go to the gas station. You can go to the doctor if you need to. And if you have a job that is deemed essential because you're in food supply or you're a healthcare worker or emergency services, you can go to your job. But for the rest of us, we have to stay physically isolated from each other for this to stop spreading. And the sooner we do it, the sooner this virus dies. And as I said earlier, the challenge for us, and this will say a lot about who we are as people, is in the race between the virus dying and a vaccine, which one wins? If the vaccine wins, I'm afraid of what that means for who we are, but most importantly, for how many people will have succumbed to this and what it means for our economy. If we can kill the virus, that means that we had the resolve and the discipline to isolate ourselves, and we'll all be back on our feet health-wise and financially sooner rather than waiting for a vaccine.
Great. Our next question is from Sue in Livermore.
Thank you for this opportunity to learn more. I'm in the high-risk group, and I'd like to ask whether the virus can be spread through the mail, letters, packages in cardboard or plastic. Obviously, it's been handled by many people, and I understand the virus can live for a while on surfaces like cardboard and plastic. Do we need to decontaminate our mail? Is it safe to send email to loved ones and friends?
Dr. Ryan.
So, as I mentioned earlier, there are some studies that suggest the virus could persist on cardboard or envelopes or things like that for a few hours. But I think the risk is very, very low. But I think that if you want to reduce the risk even further, wiping down your mail or your packages with appropriate alcohol-type solution or something that kills this virus is certainly a perfectly reasonable thing to do. I have to say I have not been doing that, and I do think that the risk is quite low. But there's no harm in doing that if that feels like it'd be a useful thing for you to do.
I think it's Mike. The only thing I would add that has become a personal habit, and there's really no silver lining in all this, but I'm noticing more and more of my friends and colleagues and loved ones really pay attention to hand hygiene, where we're using Purell or alcohol-based soaps. We're washing our hands more frequently. So whether it's touching a doorknob or you're in the elevator or you're touching the mail, I do think I find myself and others washing our hands on a much more frequent basis, and I think that's just probably a good tactic while we're in the middle of this.
Great. Our next question comes from Vicki in Castro Valley.
So my question is, how will we be able to tell? We're staying home. How will we be able to tell if we're doing enough? I'm starting to see coming online, 3D printing directions to make masks or YouTube videos to sew your own surgical masks to donate. So how do we know that we're doing all we can be doing?
Vicki, that's a great question. I think the moment for me was, as we're all maxing out our Netflix consumption, was last night watching a movie with my wife and seeing two friends hug in the movie and cringing, like, oh God, like they're not practicing the physical distancing that you're supposed to. So it's like, because you're doing it yourself, you see others shaking hands or being close, and you're like, oh no, that's not how it's supposed to be. That, I think that is when you've kind of conditioned yourself, as Dr. Anderson said, that you're just in the changes you're making in your personal hygiene, but also then it's the harder decisions. And I have a family member who is not in good health and undergoing different medical care and treatments, and I really want to see this person, but I know that would be selfish if I did that, even though I have no symptoms, that I could still pass it along to this person. And so, as hard as it is, I'm deferring any of those visits until we're out of this. And I know that could be for a very long time, but that's just where we're at if it's not worth even the risk. And I think that's where you get to the point where you can stop the community spread.
Great.
I guess the only thing I would add, can I add one more thing? I'm sorry.
Yes, please do.
It's Mike Anderson. I'm sorry to interrupt you. Just finally to highlight something the Congressman said and say it in a slightly different way. If you look at the news out of China, one of the things that we are really going to be tracking closely is the number of new cases per day or per week. And if we're going to flatten the curve, you can see the curve is the x-axis is time and the y-axis is cases. I think that's one of the things that both the CDC and the hospitals are really going to track. So all of this really is for a purpose. And as the Congressman said, it's to prevent the spread and prevent the virus from having more people to infect. And I think that tracking the number of cases is going to become something that's very important. There's going to be a number of things when we claim victory that'll determine that. But I certainly think making sure that we keep close attention to the number of new cases is really important.
Thank you very much. Just as a reminder, if we weren't able to get to your question, you can dial *6 and leave a message for our staff, and we will follow up with you after our call. Our final question today comes from Rupa in Livermore.
Hi, I'd like to know what people can do to physically, financially help each other and the community. I feel kind of useless just sitting at home when I know I have all the resources I can make use of. Is there anything you can suggest?
I'm going to let Dr. Reingold and Dr. Anderson go, and then I'll wrap things up with that question, Lupa. Thank you.
Well, I do think that as already been said, I think in terms of personal time and energy, leaving money out of it for a moment, trying to make sure that, elderly neighbors and other people who may be homebound or unable to shop for themselves, to try and look to the needs of friends and neighbors in a safe way is certainly a contribution all of us can make. In terms of financial or material means, obviously we've already heard about people, potentially donating masks or other types of materials. I've even seen some things on the news about learning how to make masks. That strikes me as fairly heroic. But obviously there are all kinds of community groups that could use additional financial support that are out there, trying to help at the community level. So if you're talking about making a financial contribution, I'm sure there are a number of community groups that could really benefit from that and the work they're doing.
Yeah, I just add to that in that I run a children's hospital. Children's hospitals are, on a good week, dependent upon philanthropic support to help us carry out our mission. And I must say, although I know we'll get through this together, as the Congressman said, there are some places I worry about, and that is the nonprofit sector, the charities where people aren't able to volunteer their time, or because of the financial issues in the markets and unemployment, that they may not receive as many contributions as they have in the past. So I would agree with everything that Dr. Reingold said. I would also just add that I really believe now is the time, if you have the means to support a nonprofit through philanthropic means, I think this is going to be a really important time for them as well.
Well, thank you to Dr. Reingold and Dr. Anderson, and thank you to the people you work with in the healthcare profession who are serving such a need that we have right now, and it's going to persist for quite a long time. And we're all going to do what we can to make it better. But you and our doctors, our nurses, our healthcare workers is what gives us a chance of beating this. I would just say, Lupa, there's a number of different organizations in the community who are adjusting to what the CDC guidelines are as far as how many people can be together, what the governor's shelter-in-place orders mean for us, but they're still trying to serve those who are in the most need. For example, this Sunday, the Hayward Rotary Club, which I'm a member of, working in a sanitary kitchen with the physical distancing requirements, will be serving food from packaging food from 2:30 to 5:30, and then driving them to meals for seniors and the homeless. And so, there's organizations that are popping up, and I would just make sure as you look at what the organization is doing, just really scrutinize whether they are following the physical distancing requirements and the personal protective requirements that you're going to need so that we don't further spread this. But there is a need out there, as both doctors mentioned, and we're all able to help out. What's so unique about this pandemic is that this country fought a civil war and reconstructed the country. We went through World Wars I and II and saw the greatest generation come out of World War II, and we rebuilt Europe. We went through September 11th, where Washington and New York were devastated by the attacks, and those were infrastructure challenges. And we saw our friends and our neighbors and our parents and sometimes ourselves affected by the mortgage crisis in 2008 when we lost homes and savings and pensions. This is unlike any of those. The magnitude of it is so much greater because of the uncertainty and because it's not limited to a region of the world or a region of the United States. This is worldwide. But as I said, the Bay Area, what inspires me so much about the people I am able to represent is not only our diversity, which is our strength, but just our inventiveness and our charity. And that's why we've always led the way in the economy, in innovation, in our tolerance and our equitable policies that really believe everyone is equal. We lead the way in every aspect of who we are as people, and I know that the people I represent are going to lead the way as we overcome this virus. So thank you again to everyone who participated. This is not the last time we're going to talk. We're going to do this again. And yes, if there's anyone else that wanted to chime in.
Congressman, could I just chime in for one more second? Because frontline health workers are an incredibly important part of the issue, but so are the public health staff working in places like Alameda County, and they're working 24/7 to protect us. So giving a shout out to the local public health workers, I think, is also very important.
Thank you again. And yes, absolutely, protecting healthcare workers, because as I said, if you look at this as the analogy to a war, as so many governors have compared it to, they are on the front lines and we need them and we have to protect them, and we're grateful for them. This is not the last time we're going to talk. We're going to have another one of these next week, and hopefully we'll have an economic package that not only incentivizes employers to keep their workforce and to pay people and keep their benefits, but also supplements unemployment insurance for anyone who has already lost their job. So we're going to continue to update you as to what I'm doing, and you can always follow me on Twitter, Instagram, and Facebook @Swalwell is the way you can find me. Our direct messages, DMs are open, and we can handle and manage casework and questions through there. Thank you all again. Resolve to take this on and physically distance yourselves, but please do not socially distance yourself. We all need each other.